welcome back to the Advancing Healthcare Innovation Show. And I'm your host, Michael Stamatinos. And if you're new to us, we're super excited to have you here. We also happen to be very passionate around healthcare innovation and adoption. And if this is your first time tuning in, let me just tell you a little bit about what we do here. We're a healthcare innovation company. We're focused on bringing stories of innovation within healthcare to life. And our aim is highlighting real people who are truly innovating within our space and give them a platform to share their stories with the world. And we've got an incredibly action-packed year. So if you haven't checked out any of our new amazing content or historical content, make sure you check it out and subscribe. We want to kind of encourage you to just share the content. If you find it valuable, share it. We'll talk about it. But I'm really excited about our guest today, Dr. Katherine Gergen Barnett. She is the Vice Chair of Primary Care Innovation and Transformation at Boston Medical Center. She's also a Clinical Associate Professor at Boston University Medical School, an affiliate of Harvard Center for Primary Care, as well as she was recently named a Health Innovation Fellow at the Aspen Institute. Whew. Welcome to the show.
That was a mouthful. Thank you,
Yes,
Michael.
yes. You have a lot of accolades, a lot of experience. At the heart of it, though, you're a clinician. You're a physician. You love to treat patients. Tell us a little bit more about your story, and let's jump into it.
Wonderful. Well, thank you so much for having me, Michael. Really looking forward to our conversation and engaging with your listeners as we continue on this journey together, talking about innovation. So you shared, sort of titles, but more importantly is just what I get to do every day, and most importantly, getting to take care of patients. So I work as a family medicine doctor at Boston Medical Center, as you shared. And for those of you who don't know Boston Medical Center, we're the largest safety net hospital for all of New England. So what that means is we take care of folks who don't have another home to go to a medical home, and lots of our patients are sort of 200% below poverty level. We have many different languages on site, and any kind of language you can think of for interpreter services via telephone. And I've actually been there now for 17 years, actually 17 and a half years. And I did my training there, and honestly, it has been the passion and the commitment of the other human beings that I get to work with in terms of really thinking about health equity first and foremost, and how do we move the needle on health equity and deliver exceptional care without exception is our tagline. And I think it really is true from every person in the ranks of the hospital is really thinking about that. And in my role, I've worn lots of different hats, and I've been medical director, I've been residency director, and as you shared, I'm vice chair of primary care innovation. And I know we're going to talk about it more, but what does that mean, especially as
Yes.
like a safety net hospital? And how do you kind of deliver on that promise day in, day out when, when we're not a kind of typical innovation hub as you might think about? But again, I feel very blessed to know my patients and get to take care of them and know the families that I take care of.
I love the tagline. You said delivering exceptional care without exception.
Yeah.
And you mentioned health equity, and that happens to be a buzzword that's been tossed around a bit right now. That really kind of alludes more also to access to care, good quality care, regardless of where you're from, your background, et cetera. Can you maybe share a little bit about how you view innovation, and from the lens of access, how has that evolved over the course of the last, I mean, we're coming through some very interesting times. How has that evolved over, through the pandemic, now that we're starting to see a little bit of light at the end of the tunnel? How has that evolved? How has that changed? And I'd love to get your input on that.
Sure. Yeah. Yeah. Well, again, I can share through my 17 plus years that we know very much firsthand that the lack of access to medical services has been a huge issue in terms of driving health inequities. But for better, for worse, and I actually think maybe it's a silver lining of the last 2.5 years of the pandemic, is that has been spotlighted for many, many other people who may not have been thinking about it, recognizing how deeply health inequities drive our country apart, and drive health outcome disparity. We see it across every single chronic illness. And obviously, we've seen it in terms of the number of people who've been infected and have died of COVID 19. Um, and so I think a perfect kind of intersection maybe between the health equity issue and the innovation issue is telemedicine, right? And so just kind of taking that as a spotlight and kind of dissecting it into what that means around innovation. So as we know, all of us, including providers, at least right in the beginning, had to pivot super quickly to get on these platforms for telemedicine that were available to us prior, but obviously weren't being, utilized highly at all. Very small percentage, less than 10% of visits were done via telemedicine. And then all of a sudden we had to quickly transform, quickly innovate on all the different platforms in terms of how do we create access for patients, how do we make sure that we've got access for providers, sending all our providers home with things like iPads, things like that. But what has become so clear, and what became really clear to us even within the first year, is you can talk about innovation and you can move the needle quickly, but unless you're really addressing some foundational innovation aspects, in other words, unless you're actually working on the ground and building deep and strong foundations, all the other innovations are going to crumble, right? And
Yeah.
so for us, that meant, thinking about what's Wi Fi access for a lot of our folks who live in these urban communities. We talked about digital redlining. That became a real term because we were recognizing that people who lived in the same communities where they had been financially redlined, in other words, they hadn't been able to get a loan for their home and lived in certain parts of Boston. And I know we're not alone in the way our city has this egregious history. Those were the same folks who didn't have great Wi Fi access. And we know that, especially during those early days when all the kids were home and they were having to do their schoolwork, also on the Wi Fi, there was very little access for patients who were trying to get on. And then, not just that, but also thinking around what's privacy? Like, how are people who are living in multi generational homes going to feel safe sharing what's going on for them medically when they have no private place? Thinking about actual cultural kind of competency, quote unquote, in terms of using the internet, right? So we know that for people who English is not their first language, or they're older, they may not even know how to access these technologies. So here we were creating what we saw as innovation, but we hadn't actually built up those foundations for people to use that innovation. And frankly, one of the things I've argued, and op-eds I've done, and research I've done, and talks I've given with my amazing colleagues, is really saying unless we build up the foundation, this innovation is going to continue to drive health wedges and health inequities in our communities, because we can't continue to perpetuate these systems of thinking that all strategies are going to work for all people. And so how do we actually address, right, where there disparate measures that need to be enacted?
So take me through an example. You talk about foundational innovation as it pertains to that one scenario about Wi-Fi. How many people were on the team? How did you guys kind of organize and kind of march towards what the objectives were? Can you give us a little bit more detail in that, and maybe some of the things that worked well and maybe some of the things that didn't work well, how you had to pivot and kind of maneuver through
Yeah.
this?
Yeah. So I think for us, it was really thinking about, first of all, the very beginning was all hands on deck. Whatever you can do, send out a mail pigeon, and if somebody receives a message, like all good. Um, but then it was really working through, thinking about, again, early days, working with our IT team, and making sure that there was actual safe platforms where we weren't just having to FaceTime a patient and, thinking about HIPAA compliant things. But I think your bigger question is, how do we start to address some of these barriers, right? So how do we actually screen, in terms of thinking about teamwork right now, right? How do we actually work with our medical assistants and patient navigators, and our behavioral health folks and our pharmacists, right? These are all sort of patient centered medical home people who, frankly, all need to be in some of those visits, especially for our most complex patients.
Yeah.
I mean, that's good care, right? And that's something that we've known for a while in medicine, but kind of got shortchanged, I think, with telemedicine. So, how do we build up multifaceted platforms where all those players can come in, including interpreters, right? So we can actually make sure we're giving the best care we can, and appropriate care. And then how do we also, prior to those visits, screen people? So one of the things that we've been working on is um, thinking about telemedicine and access to a video visit, or even just a good telemedicine visit, almost being a social determinant of health, right? So
Hmm.
adding it to that list of social determinants of health, saying, if you don't have enough food, we know that your health outcomes will be more poor, right? If you don't have proper shelter, if your education got cut off, all of those things, thinking similarly around access to any sort of telehealth appointment, being, either a facilitator or a barrier to good health outcomes.
So as you guys were going through this, it sounds like the collaboration and teamwork was likely at a really high level.
Yeah.
Have you seen that dip a bit? What's has there been a change, or do you still see it high capacity
Yeah.
team functioning really well? What's that been like?
That's a really good question. I actually was asked in an interview about just this question around Pfizer, and Moderna now being in a legal battle around vaccines. And the reason I even bring it up is, like, once you come out of the emergency, like, there's not such a, like, all for one and one for all
Right.
sensibility, right? It's like,
Yeah.
oh well, this is over, and so now we're going to sue you, or and so obviously that's not what's happening in our teams, but I'm just saying, like, this sense that this urgency emergency is fading actually means that we can work better as teams, because you're not just always putting out fires. You can actually think proactively and not reactively all the time. And I think we've learned a lot in terms of, again, what is working in healthcare and not what is not working in healthcare. I think we can all say that healthcare has a lot of cracks that need to be fixed. And one of those pieces is recognizing that team based care that you were talking about, especially in primary care, is something that has to be so deeply invested in right now, on a state level, on a national level, recognizing the critical function of primary care to take care of patients, and frankly, to pivot towards innovation every single opportunity we have. And I think, in some ways, people are really burnt out, so they're not able to give, kind of loan their voice to that right now. But if they were able to loan their voice, what I hear from my colleagues is, how do we take all these lessons and kind of build towards the future? So that's, what we're looking at now, in terms of, again, revisiting the foundational things that need to be fixed, innovate around those so that we can actually fly towards a healthier future.
Is there a way that you're prioritizing those things? And if so, what is sort of the methodology that you've been using to I'll just call it prioritize, shift them, codify it, and then say, all right, we need to execute here. What is that? What does
Yeah,
that look like?
yeah. Well, so good news, which is that healthcare continues to move towards this value-based care, right? So we've all heard it. I know none of
Yeah,
your listeners will find this new. We've heard it a million
right,
times, and yet we talk about it and talk about it, and really, at the ground floor, it's still fee for service, and we're all running like hamsters in a wheel. So that is actually, we're actually, finally getting into big pilots where we're doing value-based care. And with that, doing a lot more population health and thinking about how do we build the infrastructure towards population health. And with that piece of it, thinking about who are our quote unquote super utilizers, the people who are most ill, have the most risk of being readmitted to the hospital or admitted to the hospital to go to the ED, and then really focusing on those folks. So, for instance, this evening, I have a clinical session specifically dedicated towards reaching out to some of my kind of highest risk patients, and checking in on them, which is makes me feel really good because that's part of why I love my job, is when I get to actually connect to people and see how they're doing. And again, it's thinking about being proactive and not reactive, on all of the different kind of chronic illnesses, and how do we set up systems together, around innovation, like and not have it be some big fancy thing, but like, how do we make sure that all of our patients have blood pressure cuffs, and that those blood pressure cuffs can give readings into the computer, and that all the population health data is actually accurate and disseminated and readable, and can actually be actionable. And so I think that's really where we're at in terms of, like the day-to-day operations. And obviously, nationally, there's a lot of work a lot of us are doing on policy, and investment in primary care, so that we at the front lines have the funding and the capacity that we need to innovate when we see something that needs to be changed, right? Because again, it can't come from the top down. People who are not doing healthcare can't say what's needed. And frankly, people on the front lines need to be listening to people in the community to hear what's needed, right? And that's another missing gap that actually we need to be doing in the future as well, is really listening to the community, setting up funding so that more research can be done, with community-based participatory research. And so that kind of dyad between the community and the frontline providers really needs to have the flexibility to be doing that innovation.
Well, there's an element of you still having a level of connectedness to patients where you still can see maybe where some of these gaps are, that allows you to maybe get them to the level where they can be tended to at scale.
Yeah.
And I guess, what are you seeing as a leader, as a clinical leader? Do you find that there may be sometimes there's a disconnect between those that are in leadership? They hear about these problems, but it's one thing to actually experience them firsthand. I
Yeah.
guess maybe if you can maybe talk a little bit about that relationship, and
Yeah.
how BMC is really sort of staying ahead of the curve on that, especially with some of the underserved and overlooked populations that you guys
Yeah.
are dealing with.
Yeah. Um, it's amazing. Most of the clinical leaders that I know are also still seeing patients. So that's really a gift. And again, like I said, we all share so much the same vision. All of us could be at lots of other different hospitals. As people know, Boston is chock full of hospitals, but many of us stay for years and years because of our patients and our commitment to that. And um, I think that relationship, as you alluded to, is the heart of everything. And it's the stories that change you, when you get to listen to patients' stories, when you get to be part of that story. It builds way, like, it's encyclopedias of knowledge, versus reading articles. I mean, both are important,
Right.
but it surpasses scientific data in the way that you can see all of the ways that certain things play out in a patient's life. For instance, if you have somebody who has diabetes that's insulin dependent, and you are hearing from the patient firsthand that they can't get their insulin because of the price hikes on insulin, you know, it's one thing to read a policy paper, it's another thing to see the devastation that it plays out in someone's life. And as a family medicine doctor, you're also taking care of generations of families. So you're
Yeah.
seeing the sequelae on the children and on the parents. um, so that is huge. And then the other thing is thinking about things that aren't traditionally named medical problems, which are, we know, as chronic conditions.
Right.
And for instance, I was just talking to a colleague who's a really dear friend, who's a trauma surgeon. She's actually head of the trauma surgery at BMC. And it's a special place when one of the heads of family medicine and one of the heads of trauma surgery are really close friends. But we're talking about sort of the trauma being a chronic disease, also. And you can only sort of get the narrative of that again by listening to people's stories and bearing witness, and shepherding people through these really challenging times.
To the extent of which you're able to, would you mind maybe sharing a story, an encounter, to the degree that you can, that maybe highlights and encapsulates foundational innovation when it's working at its best?
Yeah. Um, Yeah, so absolutely. So like I said, I have so many families that I get that have the privilege of taking care of. But one family in particular just came to mind when you said that. I take care of the mom and all the children. And this is a mother who I've been seeing for years. And actually, her children call me Dr. Mom, which is really sweet. And I was there when her partner came out of incarceration, which is, again, thinking about what is impacting our patients' lives. And they decided to have another child, and I took care of her during all of her pregnancy care. Um, and 1.5 months after the baby was born, the partner and the father of this child was shot and killed. And so obviously there's no word for the devastation there. And so, for me, it was A, the relationship, and B, kind of understanding at a very basic level what this family needed, beyond just kind of the grief and grief counseling and support. But one of the things that became clear was not only was the mental health consequences, huge in the family, but also mom wasn't able to move out of this apartment, as a result of all of these things going on in her life, which was becoming more and more moldy. And one of her children has asthma. And so the asthma was getting exacerbated by the mold. And, fundamentally, by screening and understanding again, the social determinants of health, which I would argue are actually foundation for any kind of innovation, right? And
Mhm.
really, innovation is, how do you apply new ideas to make things better, right? So it's like, how do we actually understand that medicine is not just these one set of encapsulated things that we need to do, but that we have to kind of reach into domains that we don't normally do? You know, again, working with community partners, so that we were able to get her into a new apartment. She was able to go back to school. So all of these things. And now she is ready to kind of be in her life as a full person and take care of her kids and participate. Actually, she's now participating in leadership things at the hospital level. So there's so many pieces that, that's like that's a microcosm of somebody's life. in terms
Yes.
of thinking about what are the things that you need to build upon and build up so that you can even get somebody to a baseline where we're not talking about innovation as this big shiny sparkly thing, but we have to say, well, where does that intersect with our patients' lives, and how are they then ready to receive it, right? And so thinking about that on the individual level and the family level and the population level and frankly on the policy level, where we're creating this level ground for people.
What you just shared there is so powerful. And it reminds me of, well, sometimes there's a focus so much on the tricks of the trade of innovating that people never end up actually innovating. And what you're describing to me is meeting someone where they're at on their journey. And there's the human aspect of innovation that often is maybe overlooked.
Yeah.
And something as simple as maybe going out of your way, making an additional phone call to help someone find housing, that really is innovative.
Yeah. Yeah.
The key is then, can you apply a new idea to help do that at scale?
Exactly.
Can you do that
Exactly.
not just for one person? Can you do that for
Exactly.
hundreds? And how do you
Exactly.
do that? And how do you put that out?
Right.
I'm curious, and if we're having this conversation, let's say a year from now, and we're looking back at your time, what would make you feel really satisfied about the progress that's being made on foundational innovation at
Hmm.
BMC?
Wow, BMC and kind of writ large. I mean, one of the things that I think is critical, and I alluded to before, but I think it needs to be one of the driving forces, is how do we continue to have community voices, centering what we do, right? So really having, one of the things that I've helped create with colleagues is a youth advisory board where we're really having youth that identify as BIPOC at the table, driving, policy, health policy at BMC forward for youth. Similarly, how do we continue to get patients engaged in driving what our innovations are by saying, what this is what matters to me,
Mhm.
and how can I work with you? How can I give you my lived experience and all my wisdom to drive the tools forward that will actually change, like you said, not just my life, but the community's health?
Yeah.
Um, I don't know if that's going to happen in a year, but I think as we're starting to kind of regather and sort of pick up the pieces of all the things that have been lost over the 2.5 years, I'm very hopeful that we're able to bring again community voices forward, and have those stories drive us to change.
Yeah, people resonate deeply with those types of stories. It just happens to tugs on the heartstrings a little bit. I'm curious if there is an ask that you would have of this community, and maybe whatever it might be, what would help support you and your work, and basically what I would say is your mission. You're not just working at a job. This is your calling.
Yeah.
You are spewing with passion here.
Yeah.
What would that ask look like if there was
Yeah.
a ask?
Yeah. Well, a couple of things. One is I want to ensure that anybody who's listening who is, responsible, part of a team looking at the next set of innovations and what's happening in healthcare, always asking yourself, first, where's the health equity piece of this? How can I make sure that health equity is at front and center of what we're doing? Are we actually going to be helping people, all people, or are we actually going to be helping people who always get helped? Right? So, how do we think about all boats rising? And then also thinking creatively for people who are funding projects, thinking creatively around how do you engage community voices? Don't be afraid of that. Actually recognize that this kind of work is messy. It's complicated. You can't just say, this is my objective and this is my method and just walk forward. You have to say, I'm here to learn, and like, let's walk forward together. And it might be really messy and complicated, but it's the right thing to do. And so not being afraid to engage in that.
Absolutely. And I'm curious, there are other hospitals that are in a similar situation as BMC. maybe not necessarily in your backyard, but I know here in Chicago there's
Yeah,
safety net hospitals.
sure.
What type of interactivity do you get between safety net hospitals? And is there open lines of communication? Are there bridges where you can share little wins? Is there anything, does anything like that exist? And if so, what are the barriers for that?
Yeah, yeah. So, certainly the CEO of our hospital, who I love, a woman named Kate Walsh, is engaged in those conversations, and I know, other people as well. But, um, I would say day to day, people on the front lines are not, in those kinds of conversations. Um, that being said, I think your point is really important, thinking about like what are lessons learned, right? How do we collaborate? How do we like do more national work? Again, because I do healthcare policy and I'm on committees nationally, I
Yeah,
get to hear some of that.
yeah,
But how do we actually make that more manifest in terms of, transparency of communication? And so I think that's, some of the work ahead of us.
awesome. I guess just sort of final notes here. If there's anything else that you want to share with the group, I mean, how can we follow your work, the work of um, BMC? What's the best way to kind of keep track and tabs of
Yeah.
some of the little wins and some of the learning lessons, and hopefully you'll be able to share them widely.
Yeah, yeah. Well, despite being vice chair of primary care innovation, I'm terrible at tweeting out my own articles and all of that. But they're all there. I'm trying to get better. But there's certainly, first of all, people should feel free to get in touch with me. I love collaborating and speaking at conferences and panels. But really, I think more importantly is how do we if you have a win, how can we win together, right? And so, kind of being really welcome to have that sense of collaboration. A lot of the stuff we've been doing at BMC, you can certainly look us up. We write all kinds of articles around it. I've written a lot of op-eds in the Boston Globe around some of this work and do regular public radio as well, kind of addressing some of these pieces. But I do think that, again, none of us can do this alone. And we really, for those of you who are on this path, I really welcome working with you and hearing from you and working kind of shoulder to shoulder together.
That's phenomenal. I was gonna say, what's one thing that you one golden nugget that you can share with the group that they can take action on. And I think that's it that you just said. It's like, hey, I hope you're open to collaboration,
Yeah,
and it's all about taking action. It's
exactly.
about bringing a community together of folks that really do care for the common greater good. And I'm really fortunate to have met a number of people that are in your boat
Yeah,
that deeply care about the work that they're doing, about serving those that are often overlooked and underserved, and making people feel like they matter.
yeah,
So if you have, I'm just putting it out there, if you have an article that you want me to share, I'm happy to share it with our
sure.
community. I'm sure that they're really insightful and brilliant, and I'd love for the folks to kind of keep track of your work. So if you want to
Beautiful.
use me as a conduit, I'm happy to
Thank
share it.
you, because you're
Not a problem.
probably a lot better at sharing than I am.
Well,
I'll
it's
be
about
delighted
everyone.
to.
Yeah, it's about people leaning in into their
Yeah,
giftedness, right? And I view myself more or less as a bridge builder,
thank you.
and we're building bridges to kind of connect community and people together in health and care, and it all matters. So for those of you that have joined us, if you found this content helpful for you, would you mind sharing it on social media, sharing it with your networks, liking it, subscribing it? All of this type of interaction makes a huge difference. And if you haven't, make sure that you maybe put something in the comment below, maybe some tidbits of innovation that you've seen that have worked in these types of clinical settings, and we'd love to see that kind of interactivity. So um, Dr. Barnett, it's been really just a real pleasure to have you on today and just to share a little bit of wisdom with the audience. And I'm looking forward to having you maybe come on in the future and sharing more of those insights. And I think you've planted the seed in me that says, hey, you'd love to be able to connect and intertwine with other leaders and other sort of institutions that are dealing with populations. If nothing like that exists, then maybe someone who's listening to this, maybe that's enough of a spark for them to want to make that happen, that come to a reality. So thank you again, and I'm looking forward to our next chat.
Thank you so much. Take care.
Awesome.